All right. So, do you guys just want to kind of briefly introduce yourselves? I can start. I'm Morgan Sickinger. I am currently a marriage and family studies major. This is my last semester. I start my internship in April, so I'm really excited to be done. And I live in Phoenix. About me.
All right, well, are you done, Morgan?
Yep, go ahead.
Okay, I'll go ahead. All right, so I'm Kristen Helbush. I'm currently in Idaho, but I'm originally from Indiana. And I'm currently studying film and consumer sciences, but that might change. I'm not totally sure yet. And been here for like 3 years at school.
Awesome.
Well, I can go if you're done.
Okay.
I'm Emily Buss, and I live in Spanish Fork, Utah, and I have one more semester left, and then I'll be done with my marriage and family therapy degree.
Woohoo!
I'll go.
Okay, you can go.
I'm Caitlin Madsen. And can you hear me?
Okay.
I can.
Kind of went weird. Anyway, so I'm Caitlin Madsen. I'm a senior. I'll be graduating in July, marriage family studies, and I live in Portland, Oregon.
Are you done?
Yeah.
I'm Alicia Nilsson. I actually do live in Rexburg, Idaho. I am actually an early childhood special education major, and as much as I wish I was almost done, I'm nowhere near being done. So I still have a few years, and I've been in it for a couple. So, but that's because I also switched. So I switched my major 2 semesters ago. So trying to finish this one.
Did you grow up in Rexburg?
I didn't. I was born in Utah, but actually grew up in Alabama.
Okay. Because I don't know if you know where this is, but I'm from Ryrie. You know where that is?
Yeah, I know where Ryrie's at.
I moved to Phoenix 2 years ago, so I'm originally from Idaho.
I like it. It's home to me now.
So, if you were from Ryrie, what made you decide not to stay in Rexburg to go to school?
I did go to school until I got my associates, and then I got married.
Oh, that
And
makes
so
that's a good reason.
yeah, I wish I was still. I loved it. All right, so I think that the first thing that we should do is just briefly share some points about the interview. So why don't we talk about who we interviewed, and just briefly about the child that we interviewed. I interviewed a father. I work with him, and his daughter has Down syndrome. She's 10, and she is actually a twin. So it was really interesting because he actually had somebody to directly compare her with, which was pretty cool. So, yeah, go ahead. Who wants to go next?
Do you want me to go next?
Yeah.
Okay. So I actually interviewed my sister. She has 3 kids, and her second one was actually born with a heart condition, and that heart condition has had some effects just on her development, and she actually ended up having a stroke around the time she was 2, and so it's made it a little more complicated with like her mobility and her speech and just different things like that.
Awesome.
I interviewed a friend of mine. We went to high school together, and then we ended up getting married on the same day. It was kind of crazy. And then we had little boys a couple months apart. And her second son, who is about a year and a half younger than her oldest, was recently diagnosed with autism as well as sensory disorders. So I talked to her about that, and it was really interesting.
How old is she? Or how old is he?
He's 2.5. Sorry.
He's 2.5. And not Emily, Kristen. How old is your niece? Did I say that right?
Are you talking to Kristen or to me?
To Kristen.
Okay, sorry, it glitched out for a second, and so you kind of paused. The little girl, she is turning 5
Okay.
in May, I think.
All right. So, who wants to go next?
I can go. I interviewed a father who has a 2-year-old little boy, and he doesn't have any developmental disabilities or impairments that they're aware of.
Okay. Awesome.
I did actually a lady that I work with. Her son was diagnosed. He's 7 now, but he was diagnosed with, it's more of just a mild case of autism, but it is autism. And then they also have a 10-year-old daughter who they, can compare to kind of see where she was at.
Does he have Asperger's?
Not that they told me, but they just said that it was autism. So.
Okay. All right. So, it says share some of the points. So, if each of us want to go and kind of briefly describe maybe the areas that the parents said that they were, delayed. Some of them are obviously going to be more than others, but my little girl, her biggest one was speech, and she has a very mild form of Down syndrome. They're LDX, and he's like, we're really blessed. He's pretty normal, but so her biggest delay is in her speech, and she didn't start talking until she was like 2 or 3, and then they couldn't really understand her at all. And even now, she has a speech therapist that she works with. Some other major delays that she had was walking. She didn't start walking until she was 2 or 3, and then she didn't start running until almost a full year after she started walking, which is really pretty late because they usually start running shortly after they start walking. So with school, she isn't in any special needs classes. She goes to the regular classes with her brother and other classmates, but she does have an aide with her to help keep her on track. And yeah, she's a little slower at math and English. Other than that, she's normal, he says. So.
Do you want me to go ahead?
Yeah, go ahead.
Okay, so the girl that I interviewed with a lot of this stuff just as a baby, she had a lot of delays. Most of it was because of the fact that she was actually in the hospital for probably the first 6 months of her life. And so I think she didn't really move around a lot. And so for that, her mom said that even things such as crawling and rolling over, that she was a lot more delayed in those things. And I don't think she started walking until she was about 18 months old. And most things were just delayed with her. However, speech wasn't a problem for her until after her stroke when she was 2, and then she actually had to have therapists to help her with her speech again because she just would slur her words and couldn't speak as well. And potty training was also something that was pretty delayed just because of all her medical issues. They didn't push it as much, and that was something that was a lot harder for her to just get down because, I don't know, she just was behind with a lot of things. So, I don't know. Anything else that I should cover?
No.
I can go. So since this 2-year-old is the only child, he didn't really have anything to compare the development or milestones to. The only thing that he wasn't really like, so this little boy has been hitting a lot of milestones early and talking and expressing himself a lot early. His doctor said the only thing was that he didn't crawl until he was around 11 months old, and then he immediately started walking, so he almost kind of skipped the whole crawling phase. And he was really, really small when he was a newborn. He didn't gain weight very well for several months, but his talking and teething and communicating and all of those things, he's exceeded. And they haven't done potty training yet, but he's starting to show an interest in it.
Awesome. A lot of kids I've heard actually almost skip crawling. So I don't know if that's, I don't know if that's not normal, you know? Like, I know a lot of kids or a lot of parents who tell me that. So.
Yeah, there's more studies now about how crawling is important, just moving the hands and the arms and the legs, the opposite ways. It helps with certain things down the road, I guess.
That's interesting. I wonder if it's just maybe the coordination of.
Yeah, I think that's what it is.
Yeah.
My son crawled and then he walked a couple months later.
All right, who wants to go next?
I will.
I'll go ahead. Oh, go ahead.
For my little boy, he was mainly really just delayed in speech. He, for the most part, with his movements and walking and everything, he was very close to being where his sister was. They did say that he was a little bit behind on actually walking, but crawling was very similar to her. They had some problem with potty training, but they didn't have the problems that they were told they might have. So that wasn't, they enjoyed that it wasn't as hard as they were anticipating. But it definitely was harder than his sister. He, for the most part, he does everything with regular classes, just like Morgan's little girl was. He is able to go. He does have an aide who helps him a good bit. He is kind of behind in his classes, but they've worked with him to kind of keep him up and try to keep him where he is learning those things. And if he does fall behind, they have actually allowed him to be able to be moved out of the classroom to get more one-on-one help to help him catch up a little bit more. So.
Awesome.
One thing to add really quick is that often boys are trickier to potty train no matter what than girls. They say it's harder for boys than for girls. So sometimes that's kind of a hard comparison between boys, like brothers and.
Mhm. And it is, but I've babysat so many kids that I've actually babysat two 2-year-olds for a long time, and the boy actually would potty train way before the girl would. So I've seen it in both scenarios. So that's a hard one to call to necessarily say if that was the autism or if that was just being harder to potty train. So.
Right,
Yeah.
that's all I'm saying. I'm not saying
Yeah.
you're wrong.
Oh
I'm
no,
just
I
saying,
know. I know.
like, yeah, okay, good. I'm
Yeah,
not trying to, like, debate anything.
Oh
My
no,
son
no,
was
no, I
hard to
know you're
potty
not.
train. He
I'm
potty
just saying. I know exactly what you mean. I know exactly what you mean.
Yeah, everyone recommends to me that I wait until my son is 3. Everyone says that 3 is like the golden age where boys like understand and are able to communicate potty training things better.
See, and
Yeah.
I think it just depends on the maturity.
Yeah.
You know,
Yeah.
my nephew is 2, and he picked up potty training in a day. Like, and he has an older sister who's 4, and she doesn't have like a problem wetting the bed. But my sister says that she has wet the bed more times since he's been potty trained than her 2-year-old, who's a boy. So I think it's just like the child and their maturity.
Yeah, I think it's definitely, it depends on the individual child too.
Mhm. Okay, I'll go. So my cute little 2.5-year-old has an older brother who's almost 4, and she talked a lot about the comparison between the two of them because her oldest was on target or early on everything, including potty training just before he turned 2, and so her oldest was 5.5 weeks early, and then her second was 3 days early. And so she just talked about like the comparisons between watching the two different ones. And so her youngest was late on everything. He didn't walk till 18 months. She says he's still pretty clumsy and trips a lot and falls a lot. He doesn't talk very well. He still only uses maybe 2 or 3 words. He has lots of ear infections, and he continues to be delayed in the things that he's working on. He's not in school because he's too little, but he does go to a therapy every day where he has an aide, and they work with him to help him make up for his delays.
Awesome. All right. And we've talked about this kind of already. It says, what is your sense of normal, or what does normal mean? And I think that, like we discussed with like the potty training, like there is no set, they're going to walk at this age and they're going to go potty train at this age. Like every child's different. And I think normal, this is my personal opinion, normal is like, nobody's normal, but I think that there is a normal range of when something should occur. Like, they should roll over between 4 and 6 months sometime, or, so not necessarily an exact, once they hit 6 months, they're going to start doing this, but a range of normancy, that's not a word, but a range of when something is normal. Yes.
Yeah, I think you're right. I feel like what they end up doing is, they just kind of take like the average, and if you're not in there, you're not normal. But if 80% of the children do it around this time, then that's normal, and the 20% they must not be. But yeah, like who's to say that it's a bad thing or that they're not normal just because they're behind or ahead?
Yeah.
I think as a mother, like, oh no, my child isn't normal. They didn't walk when they were supposed to, or, like, I think that freaks parents out. Like,
Yeah.
it'll be okay, I promise. So,
Yeah.
I think that's true. I think it's important to have that general guideline, because if you're too far outside of it, something needs to be done to help the child. And that's something I talked about with my friend, is early intervention is super important with autism, because the more you can do earlier, the better off they'll be long term. So it's hard because you don't want to think that your child's not normal, but you need to be able to get them the help when they need it.
Oh yeah, and you want to be able to try to put the most normalcy that you can in their lives. You know, they need that. They need that structure that every child needs. And to me, I kind of see it a lot because with one of my jobs, I work with I actually work with a boy who has autism as well. So I see him every day, and I see the changes that his mom makes with him, and I see how she reacts with him, and it makes a big difference. She doesn't treat him like he's any different. He is like any other child. She disciplines him. She talks to him. She does everything she can to make things as normal as they can be. With the boy's parents that I actually interviewed, I've noticed a lot of the same things with them as well. They try to do what they can for him. You know, they try to discipline kids. They're both their kids the same way and talk to them the same way, and they don't try to make him feel like he's any different than his sister, and they just do what they can to keep that structure for both of them. And, you know, he doesn't get what he wants just because he's different and stuff like that, so.
Yeah, my coworker actually told me a story, and I think it's his little girl to me just seems so funny. I've never met her, but he always tells me that she does the Nene. Like, that's her favorite song, and every time it comes on, she dances to the Nene, which I think is hilarious. But he told me this story where she asked her parents for money for, like, concessions at her brother's game or something, and they told her no, like, no, we're gonna get dinner afterwards, you know. So she went and she, like, talked the people that were working the concession stand into giving her a free soda. And he was so mad. And he said that him and his wife feel like because she has Down syndrome that, you know, people treat her differently. And he goes, she's smart. She knows that, you know, she can use that to her advantage and she can get free stuff. And it makes him so mad. I think it's pretty funny. So I think, like, obviously, if it's a severe case, they don't acknowledge that they're different. But if it's not a severe case, then they're, you know, they still are aware of what other people do and say and act around them, and they're going to use that to their advantage.
Yeah.
They are super smart. I've seen it, and sometimes it blows my mind how smart they can be.
Yeah. All right. Did anybody else want to add to that? What is normal?
I just think it depends on the child's, like, their temperament and their interests, and also,
Yeah.
like, how supportive their environment is.
For sure, the 10 core concepts that we're learning play a huge role in that as well. Okay, so the next question is, did you find that parents were often the last to know if there was a delay or a problem with their child? How did they come to this awareness? And did you get a sense of whether or not parents were receptive to receiving service? So,
Start.
go ahead.
Oh, just what was the last part of the question?
Did you get a sense of whether or not parents were receptive to receiving services? So with my little girl, he said that they didn't, like, get tested. He goes, it didn't matter, you know, we didn't think it mattered because we were going to keep her no matter what, you know, whether she had problems or not. So they didn't get tested, but when his wife had a C-section and when she was born, the nurse picked up that her hands weren't clenched. They were open. She had open palms, which isn't normal. And and that's how the nurse actually picked up that she had Down syndrome. He couldn't even tell. He actually didn't even know what Down syndrome was.
Oh, really?
Yeah, he's from South Africa, so he's kind of, he has an excuse.
Okay, here's just a random question. But do you feel like it's less likely for people of other cultures to have Down syndrome? I feel like I don't see a lot of like Africans or Asians or children like that who have Down syndrome. Is it?
Yeah, or like even Europeans, just people outside of the United States.
I don't think it's like less likely, but I think that a lot of like their medicine isn't as caught up to ours, and so they probably don't survive as long.
Hmm.
I mean, I don't know. If I just had to take a guess, that would be my guess.
Sorry, that was kind of just a random question. I was just realizing, I was like, oh, if he doesn't know, I wonder if it's just less likely or.
Yeah, it was. I asked him the same thing because, well, I didn't ask him that question, but I was like, you really didn't know what it was? Because he went to college here, like he studied abroad, I guess. I went to college here, and he was like, no, I had no clue.
Well, I wonder if part of it is that like abortion is more common and accepted in other countries.
Oh, see, and I didn't even know that, so that could be a possibility too. But so that's how they became aware, is the nurse picked up on it, and she told him while his wife was still getting sewed up. So then he had to go break the news, which I think is awful.
Yeah. Because she had held the baby at that point.
I know. Oh, and he said that his wife had a little bit of a hard time, like, it's their only girl. She's not gonna be able to get to experience marriage and, all this stuff that girls experience. And his wife was a little, like, bummed about it, but he said that it didn't take her long to just accept it, so. What about you guys? Did you find that parents were the last to know or realize that their child had some delays?
I didn't feel you go.
Okay, my friend said that she noticed she was the one who pursued looking into it because she saw the difference between her two boys and how delayed her younger son was. So she pursued testing, and she said that her husband, let's see, he's mostly okay with it, but sometimes he's kind of in denial about it and wants to pretend that there's nothing wrong.
Which I get. I think that would be me.
I think sometimes it's almost hard to accept the fact too, because whereas someone with Down syndrome, it's pretty apparent, like that they have Down syndrome. Like someone with autism or Asperger's, a lot of times they just look normal, and so you just want to treat them normal, and that's really hard because I feel like they're sometimes more behind. Things just don't click, or they push your buttons more, and so I feel like you want to treat them like a normal kid, but you have to be a lot more patient. But yeah, I feel like you just do become in denial because they just look normal. Mm-hmm. They look like a normal child, and like all your other children, so why treat them differently? But
I think also I think like sometimes people get confused with like, well, is it a problem and a delay, or is it like just their temperament? Because
yeah,
some people might just think like, oh, this is just a difficult child, when really,
I've seen a lot of people assume it's all behavioral, and she's like, they just act out. They don't realize that there's something like cognitive or developmental that's actually causing them to act that way.
Yeah.
And like my uncle, he's been very against having my cousin tested for autism because he's been kind of in denial because he didn't want his son to be labeled for the rest of his life. But he's struggled in school a lot and behavioral problems, and he's this has been like 5 years of my aunt and him like disagreeing about him needing to be tested and diagnosed, and he's just finally being tested, and they still aren't quite sure what he has, but he's similar to autism, but it's not exactly autism. But he was in denial, and so he wasn't getting the help he needed in school. And so now that he's starting to get some help, he's changed a lot, and he's better to deal with, and he's doing better in school because my uncle finally agreed to get him tested.
Yeah. That's interesting.
I feel like that can be a really hard line between kids is when, you don't want them to be labeled and you don't want them to be different and have problems, but honestly, like, that's the only way that you can have answers and help them. But yeah, that's a really hard line because once you have answers, sometimes it's scary what those answers are.
Yeah, it gets to a point where you're just hindering their potential because you're afraid of the reality of it, I guess.
Um,
Because you want them to be normal.
Hmm.
All right. Does anybody else have anything you want to add? Okay. The next question is, do you get a sense that parents were uncomfortable or had a sense of denial, shame, embarrassment related to their child's special needs? Or did they feel a sense of resolution or acceptance and had a long-term plan for dealing with their child's needs? The father I interviewed, obviously it was from birth that he knew, so he didn't have any shame or embarrassment. Um, I know I kind of felt a little awkward asking him, like, hey, can I interview you because, you know, she has Down syndrome and I need to interview a parent with child delays. That was a little awkward for me to ask him, but he was more than willing, and in fact, he was like, "I'll just make some stuff up. I don't care what you say." But which I didn't, by the way. I promise. um, and I think like after the first initial shock, and for him after learning what Down syndrome was, like they started planning and they accepted her and they treat her just like they do their sons. So, what about you guys? What did you find?
I feel like my parents that I interviewed were very loving towards, to the whole situation. Yeah, it's not ideal. They thought about what that meant for their son's future, and they thought about how things would change, but they also accepted it and were very willing to jump in there and find what they could do to help their son to have the most normal life that he could have. And they just, to me, they have always seemed like they were just very accepting and very, very knowledgeable. They definitely took the effort to learn everything they could when they found out, and that they just, they were very, very quick to discover and do what they could and try to make sure that no matter what, he felt loved and he didn't feel like he was, this oddball out in left field. And they just seem so. They've always seemed very accepting since the day I've met them and learned everything in their families. So.
Good. Anybody else?
My friend and her is taking it head on and doing everything she can, and And another little interesting part about their family is that they're Air Force, and so he was diagnosed while they were stationed in Japan, and they were scheduled to still be there through June of this, but their son couldn't get the help that he needed while they were living there, so they got permission from the Air Force and transferred in December to Florida, and now he's in his little classes and getting the help that he needs so that he can have the best chance at the best future.
That's cool. It's cool that they let him transfer.
Yeah. Yeah, my family didn't have any disabilities, so I guess mine doesn't really apply to that one.
Okay. Go on. So the last question, and to be honest, this is harder for me to answer. This one asks, what can you learn from this experience about normative variation, mature? Does somebody have this open? Here, I'm gonna
Let me try to do it.
copy and paste it in the chat so everybody can read it and comment on it, because I can't say those words, some of them. Maturational delay, I guess. And then whoever wants to answer this one or take a stab at it, you can, because yeah. Okay, so normative means leading to an ideal standard. So I think that it's safe to say that all of our parents, whether our child had disabilities or not, they all had the same normal standard for their child after they learned about the delay than they had for all the rest of their children. Learning about the delay didn't change that. And then okay, so with their mature,
No,
is that how you say that?
I don't really know. I always struggle with that one.
That one has to do with like their normal, from what this says, like their brain maturing. So I think that, of course, the ones that had those delays were slower, but it sounds like nobody was in denial and that they all wanted to help their children have the best cognitive help they could, develop their cognitive skills as much as they did any other skills. If you guys want to jump in on these other two, you're more than welcome to.
I think one thing that's interesting is a lot of times when there's some sort of delay, a lot of times it just affects a lot of other things. Like, it's not just one thing.
Yeah.
It always has, like, a domino effect and affects more. I think it is just interesting, just like, the different delays and different disorders, how it never really is just one thing.
That's true, and I think like that brings up like a good point about why she asks us about really 4 different things, but really they all directly and indirectly affect each other.
Yeah.
Um, but I think that as a parent who isn't in denial, you just learn to accept, come what may, you accept it all. You're not just, okay, well, they're ADHD, so we're only going to be concerned about this problem. They're concerned about all their problems. So,
Yeah. And I think another thing is that if you think about it, like it says transient disorders and persistent impairments and, the maturational delay or whatever that word is, with everything that, yeah, they have, even in a transient disorder where it's probably something that they'll eventually get over, like you have to get past it, or you have to teach your child something, so that they can actually, progress, because unless you help them, like they're never going to get over it, even if it is kind of temporary.
right. Um, I actually, to go along with that, when I was younger, I was diagnosed with an autoimmune disorder, and I was crippled. Like I couldn't move my hands and my wrists. I couldn't open doors. Like I couldn't close my fingers past this point, and like it was a hard trial, and I went through it for like 10 years, on medication and stuff. But that's like I learned so much, and I gained my testimony. Like I remember when I was first diagnosed, I didn't know what it was, and I was bawling to my mom because I had like really strict diet and a really strict, like I couldn't go outside because they didn't know if the sun or the weather would affect it. And so my siblings were all outside playing, and I was bawling like, why did this happen to one of them? Why have I had this? And my mom, she just told me, she goes, Morgan, we are given trials because Heavenly Father knows that we can handle them. And that's like something that I look at now and I'm like, oh, of course you would say that. That's pretty basic. But throughout my whole life, not my whole life, but throughout, my whole recovery and even like high school, that's what I like based my life on. Like, you're given this, and I would tell my friends that, like you can handle this, like, and so I think that Heavenly Father for sure knows what He's doing, and even if it doesn't necessarily benefit the child, it benefits the family. And I look at families that have these children, and I just think like how awesome of parents they must be, because I don't think Heavenly Father trusts just anybody with these kinds of spirits. My personal belief. So, all right. Well, does anybody have anything else to add? Sig. Sorry, so you don't know.
Good. We just had about 50 to 60 minutes, right?
Yeah, 50 to 60. So we need to summarize what we talked about. If somebody wants to do that, I'll let somebody else summarize for us, and then I think we're good to go. Does anybody want to offer to summarize for us?
So we're just needing to summarize what we talked about.
Yeah.
Okay. Well, we talked about each of the children and the parents that we interviewed and just some of the differences that they had compared to other children in the family and how they developed differently and whether those were things that were apparent to the parents at first or if it was something that developed over time. And I don't know, what else did we discuss, guys?
Parents are, once they learned about the disabilities, they just did what they could to help their child to continuously progress and to just adjust to the normal for their child's situation.
Yeah. All right. From my understanding, I just need to post it on the discussion board. So I'll do that, post the link, and then we're good to go.
Okay. Because
All right.
do you have to post it on YouTube or anything, or just a discussion board?
Well, I'll post a YouTube video on the discussion.
Oh, okay.
Yeah. So, because when I record, it automatically loads to my YouTube.
Okay.
So,
Great.
all right. Have a good week, guys.
Yeah.
Thanks, you too.
Thanks.
Bye.
Yeah.
Bye.
Bye.